Hello, so today we are going to be introducing our part-time and online Masters in Transformative Oncology. For those of you who don't know me, I'm Hazel and I am the course advisor for this program. So I'm here to help you at the pre-application and submitting your application stage, and I'm here to answer any questions and help get you more information about the course. Today I'm joined by Dr Suzanne Johnson and we're going to be introducing the program to you. So I'm going to hand over to you, Suze.
Thanks, Hazel. Hi, everybody. So today's session, really, we're going to talk a little bit about the course as a whole. So answer some of those questions that I expect some of you are thinking about or wanting to know answers for if you're thinking of applying for this programme. Things like, what does the course cover? What skills will I learn? What makes the course unique? And of course, is this course right for you? And then we'll move into a focus on Unit 1. So understanding the challenges of tumour biology, and we'll go through some of the learning outcomes and what and how you will learn, and also some of the assessments. So it's no surprise and it's no secret that cancer is a global concern. It's a leading cause of global morbidity, disability and mortality. And in 2020, over 19 million people were diagnosed with cancer, resulting in nearly 10 million cancer-related deaths. Since then, and made worse by the pandemic, there is global acknowledgement that the lack of oncology workforce has and will continue to have a detrimental impact on patient outcomes and overall population health. It's important to recognise and acknowledge that cancer is an extremely complex collection of different diseases, and it's a field which is rapidly evolving. So what is transformative oncology? This programme has been devised to provide education around understanding the underlying biology of cancer, but also to give an appreciation of the diversity of individual tumours and different tumour types, and also patients. And it's about achieving better outcomes for patients with cancer through collaborative working, innovation and translational research, and building those multidisciplinary teams which bring in the innovative approaches and a holistic approach to develop personalised strategies for cancer treatment. So what does the course cover? The first unit is around understanding the challenges of tumour biology. And this really aims to give an appreciation of tumour diversity and how this can impact different detection and treatment strategies. The second unit focuses on cancer as an individualised disease. So this is about appreciating that both tumours and patients with cancers are individuals. And by gaining an understanding of how underlying health, genetics and lifestyle choices can contribute to individual cancer cases, risk, responses to treatments, etc. In the third unit, we start to look at both established and experimental therapeutics and outlining both the present and future cancer treatment strategies. So moving towards treating every cancer and every patient individually. And in the fourth unit, we look at the branches of oncology. So this is really an introductory overview to the approaches to treatment across the board in oncology. So whether it's surgical oncology, medical or clinical oncology, and how these different specialities intersect and work synergistically for the best outcome. Moving on to the fifth unit, this is all about the science of radiotherapy. So it's really gaining an understanding of one of the cornerstones of cancer treatment. Then we move on to strategies for early detection. And here we start to discover really how effective screening mechanisms and the use of medical imaging tools and technology can really emphasise the advances in early detection of cancer. As we start to talk about the principles of personalised medicine, this is really about gaining a fundamental understanding of the steps that are required to realise precision oncology. And the final short unit is around delivering the best cancer care. So ways to establish a really efficient and effective clinical pathway to deliver optimal results to patients with cancer. And if you're interested in continuing to achieve a master's, you can do this by either completing a clinical practice-based placement or maybe a wet lab or database research project. Or if you want to continue your learning online, we have a research skills and practice unit, which is contextualised with oncology background. And within this unit, you will learn the skills such as formulating a research question, skills in communicating your research, and also designing study methodology. So ultimately, what skills are you likely to learn? So the ethos of the programme is really to deliver training and education with transferable skills, which will enable you to continue to learn in your journey and throughout your career. So it's really emphasising the importance of intellectual curiosity, creative and critical thinking. So to incorporate technology and innovation throughout the cancer pathway. So it's looking at your current practice and asking questions. Can this be done better? Do we need advice from other disciplines? Who can we talk to about that to make this flow more efficiently? We really emphasise the importance of reflective practice throughout the programme. So really understanding that research priorities and the clinical applications all lead to really effective decision making in the context of cancer. And it's about understanding how research and inquiry are used to create and interpret knowledge in the field of oncology. And this is something that happens throughout the entire pathway. And again, very important to introduce and champion the real power of an interdisciplinary approach to expedite the early detection of cancer, which ultimately leads to better outcomes for patients. So what makes this course unique? It's designed to be very agile, it's designed to be medically applicable and inspirational. And importantly, it's designed to reflect the changing needs in healthcare. And this is something we've absolutely seen in the course of the pandemic. It involves medically applicable education, which is important because it brings in that innovative research, the understanding of treatment and therapeutic strategies and approaches, and all the way helping you to understand how to achieve effective personalised cancer care. And importantly, you'll gain the added value from hearing from real world case studies and the interconnected thinking from Manchester's world experts. And a real advantage of the programme is how to benefit from engaging with your peers. So through community of practice and engaging with the other students on the cohort, who each will bring a rich global experience to help to deepen and further your understanding. So if you're still asking the question, is this course for me? In 2021, ESMO, which is the European Society of Medical Oncologists, stated for excellence in cancer care for the 21st century, there needs to be the intervention of multiple skilled healthcare providers. So these are from anatomical pathologists through to medical and paediatric oncologists, surgeons, oncology nurses, and all the way through to radiation oncologists and technicians. And actually, this can be extended also to include research scientists and other allied healthcare professionals such as nutritionists, physiotherapists, or pharmacists, all of whom have key roles in transforming outcomes for patients. The programme is delivered in a really agile and flexible learning platform. So you can access it part-time whilst working, or perhaps you're looking to upskill before you return to work. And it's developed to appeal to a global audience. So it's available to you regardless of your time zone. And as we've mentioned before, your learning will be enriched by the sharing the experience with diverse peers. And this is because people will be working in different job roles, they'll have different perspectives on decision making. The institutes in which they work will have different facilities available and treatment options available, which all influence the decision making.
So we're going to be introducing Unit 1 in a little bit more detail for our online Transformative Oncology course, and that's understanding the challenges of tumour biology. So I'm going to hand over to you, Suze, to talk about that in a bit more detail.
Thanks, Hazel. Hi, everybody. So now we're going to explore a little bit more about the first unit. So this is all about understanding the challenges of tumour biology. The overall aim of this unit is to gain an appreciation of the tumour diversity and how this might impact on detection and treatment. It's aimed to really build on the background knowledge of basic tumour biology. So it's not going right back to the beginning of Tumour Biology 101, but really building on and learning more about what we know now, the techniques that we use to explore tumour biology now, and extend and update your understanding of how that underlying biology can impact on the detection strategies and also any treatment success. And also we'll be providing an appreciation of tumour diversity and intra-tumour heterogeneity. It's really about exploring the concept of heterogeneity within the individual tumours, so including their cellular composition, and how this might affect tumour growth and detection. And it's also about differentiating between different tumour types and exploring how these present different challenges within the clinical settings. And you'll learn all about the new and current treatment strategies, methods and approaches used to inform key decision making. So the unit is structured with 3 5-credit elements, which are delivered over 8 weeks. These 3 credit elements are complexities in tumour heterogeneity, challenges of toxicity, and then we'll look at rarer and non-palpable tumours. So in terms of the complexity of tumour heterogeneity, we will deliver critical insights into diverse tumour types and exploring how tissue, stage, cell of origin can all affect both the treatment and the detection. We'll talk about cellular composition and also the important role of the microenvironment in tumour progression. In the challenges of toxicity, we'll start to appreciate the impact and the effect of toxicity resulting from the different therapeutic strategies and combinations, so surgical, medical and clinical oncology. And we'll understand the potential off-target effects and learn ways to minimise normal cell damage. We'll also start to consider the importance of supporting patient decision-making regarding treatment choices. And in the third part, we'll really start to look at rarer cancers and how non-palpable tumours present their own problems. We'll consider the differences in the biological understanding and diagnosis of rarer tumours. We'll start to understand the greater challenges associated with non-palpable tumours and the current methodologies that are used for screening. And we'll start to learn about developing screening and detection strategies to combat cancers which are less easy to detect. So each of these is delivered over 2 weeks with opportunities to interact with peers and academic staff, including myself and other world experts in cancer, using online discussion boards. And the unit will end with 2 weeks, which is allocated for assessments, and we'll talk a little bit more about the assessments at the end. So if we start to consider what the learning objectives might be for Unit 1, so when we talk about knowledge and understanding, by the end of this unit, you will be able to describe the different tumour types and start to discuss intratumoral cellularity. You'll be able to explain the relationship between the cells within the tumour microenvironment and how they interact. You'll be able to demonstrate a mechanistic understanding of cytotoxicity and why this needs to be taken into account with cancer care, and also start to identify biomarker sources and methods of analysis. In terms of your intellectual skills, you'll be able to evaluate the importance of understanding that tumour heterogeneity, critically appraise the challenges that are presented by the different tumour types, and really reflect on the key issues of the tumour and host toxicity. And importantly, understand the limitations of the current techniques that are used for screening, including biomarkers, and start to think about ways that we could improve those strategies. In terms of practical skills, you will be able to plan and execute guided and independent research. You'll be able to constructively debate current clinical approaches to different tumour types. You'll develop the skills to retrieve relevant supplementary information from a variety of sources, including the library or electronic and online. And also through practice, you'll be able to report your findings in a concise and structured manner. And you'll be receiving feedback throughout the unit on these. In terms of transferable skills and also personal qualities, you'll be able to present your findings in a clear and concise way using appropriate media. And also constructively deliver feedback for peers. And these skills are really important when you're working within a multidisciplinary team. You'll also be able to demonstrate independent thinking and evidence integration to formulate your hypotheses, and essentially manage your time and show evidence of scheduling tasks in order of importance. So again, all these skills and the way that we record everything will provide you with the evidence that you can take forward for future learning or future job applications. So we're going to talk a little bit about the assessment. So there's three main ways that you'll be assessed on the programme. Firstly, there are multiple choice questions. So this is denoted by MCQ on the slide there in green. These take place in week 8 They are fully online and fully automated. And really, these are about checking the breadth of knowledge and comprehension for all of the stuff that you've covered within the unit. The second is reflective practice, and this is broken up into the 2 week elements that I described before, and it's really about encouraging reflective practice. So by doing so, by contributing to discussion boards, we'll be able to facilitate peer-to-peer learning and interaction. You'll be encouraged to read something and then summarise it and then add it to a discussion board, and also to start to build a portfolio to evidence the skills that you're learning. And for this, we'll be using a platform called PebblePad, which is a way of building this reflective portfolio, which will go with you then as you go through to your future career options. And this really is a way also of promoting the lifelong learning beyond the programme. And finally, there is a comprehension. So this is all about drawing on all of the learning from the unit and demonstrating your ability to apply that knowledge to a particular case study or a particular subject area. And by way of ensuring inclusive practice, we will invite you to submit your assignments either as a written document or as an oral presentation or even an audio presentation such as a podcast. So there's lots of different options for you to submit that particular assignment. Thanks, Hazel.
That's no problem, Suze. Thanks for giving that really detailed overview of Unit 1 as well. So if you have any further questions about any of the information that you've seen here, then you can get in touch with me using the contact details on screen by emailing studyonline@manchester.ac.uk, and I'll be able to discuss with you the course in a bit more detail, or also help you guide you through the application process, or discuss your eligibility for studying this course as well. So as I say, my email address is on screen, studyonline@manchester.ac.uk, and you can also use the phone number on screen as well. Thank you for taking the time to watch today.
Thanks, everyone.